Hello, first and foremost, I'd like to welcome you all to New York Presbyterian Lower Manhattan Hospital. My name is Levita Payton and I am a member of CWA 1104. And it is unfortunate that due to these circumstances, we have to teach this course in this manner due to the pandemic, as we normally would prefer to do it in a face-to-face fashion. So, first of all, I want to introduce you to Barbara Basico. She's our chief steward, and myself, who will be teaching this course, Levita Payton. Here's just a brief disclaimer, just basically explaining that this particular video is only for the intended parties. Learning objectives, I'll briefly go over them. Basically, you'll know how to contact appropriate union personnel if necessary using the contact information in this video. You will understand and sign appropriate paperwork for union dues and contact cards. You will be able to comprehend and apply Weingarten rights. You will recognize steps to take for on-the-job injuries. You will understand the benefits of being a union member. You will gain a general understanding of our contract and how to use it. Nurses will gain an overall understanding of collective bargaining agreement benefits within this contract. Nurses will have increased knowledge on functions of the legislative political action team. Materials needed. So hopefully in front of you, the hospital has been very kind in helping us with this. You should have a CWA 1104 red contract book. You'll need a pen. There should be a union dues authorization form, a union card, and a return envelope. If not a return envelope, then you'll hand it back to the instructor that's in the room with you now. Here's just a couple of educator biographies. I know you're not able to see us in person right now. So this is Barbara on your left, and that's me on the right. And here's a little bit of a bio about Barbara. Barbara's been a nurse for a very long time. She has her Master's of Science in Nursing. She's also a legal nurse consultant. Some of her, I'll read a couple lines from her. I'll read the midsection. One of her greatest honor has been to serve as the New York State Board of Nursing chairperson of the Nursing Practice Committee, Bylaws, Long Range Planning, Professional Conduct Committee, panel of the New York State Board of Regents, Blue Ribbon Task Force on the Future of Nursing. And I'm gonna skip. Another one of her roles is in the professional assistance program, in which she assists nurses that have drug or alcohol problems to enroll in rehabilitation programs to have their license reinstated. And of course, she's our chief steward, thankfully. And just a little bit about myself. I'm currently working on my master's degree in education. I have just 3 credits to go. I've been a nurse here at LMH for over 20 years. I have worked in many different areas such as medical, surgical, emergency room, and PACU. And these are our CWA 1104 elected officials. Thomas Benedetto is our president. Mike Appoliti is the vice president. Christopher Bloom is our secretary treasurer, and George Magnuson, you'll hear his name a lot, is our business agent. This is the union's contact information. So it's CWA 1104, and it's 1 Floorgate Road, Farmingdale, New York, 11735. Office number is 516-420-1104. Fax 516-420-8390. Once we obtain your personal emails, I can actually send you a copy of this video. Here's a brief role of the union. A lot of people have not been union members before, so they're not quite sure what are some of the benefits of the union. So it's representation. We perform contract bargaining for the nurses, worker protections. That's how you get most of your benefits, is through negotiations with the hospital and the union. Organizing, and we also do political and community action. Union dues. All union dues are paid by all full-time nurses and part-time nurses within the hospital. It's contractual, and it can be found within the book, Article 2.3, page 2. The cost is 2% of your base salary, which is currently approximately $70.75 biweekly. So now I'm going to ask that you fill out the form and complete the union card provided. Right here, I made a sample so you can see what it should look like. This is the union dues authorization form. So you should clearly print your name on top and then sign on the bottom. Please be sure to print clearly, because a lot of times we cannot make out the handwriting. And here's a sample of the union card. And you can just follow those directions. And at the bottom, right underneath the bottom, we do request that you add your personal email as well as over here, so that we could have it on file. So right across here, if you could just write your personal email as clear as possible. Oops. Okay, so now we'll talk about netiquette. What is netiquette? The correct or acceptable way of communicating on the internet. I mention this because I like to ensure that we always are mindful that we are professionals and that we should communicate in the same way via email as such. Be respectful to everyone, which is a part of NYPD's credo, and the union also agrees with this. So in addition, I also want to mention that all union business you should only use your personal emails. Only the personal emails, because it's between the union and the nurse. If it matters the hospital as well, then you would use the hospital email. This just is a little funny slide. So basically, this is all with the netiquette and respect. Just no rumors, gossiping, cyberbullying. We do not send emails like that. That also keeps you from having to call me, which is your delegate. Okay, a little bit about our insurance. We have United Healthcare. It's negotiated by the union but administered by NYP. Please ensure to sign up right away as directed so you do not lose the window. You only have 1 month in which to sign up from your start date. There's no cost sharing, meaning that you don't have to pay into it. This was negotiated for you during contract bargaining. Copay is only $10 for all doctor's visits. ED copay is $35. And we also want to just remind you that if you have a new baby or get married, be sure to add them to your policy within 30 days, or after that window, you will lose this opportunity. On the job injury. On the job injury, no one, of course, we try our best not to get injured at work, but if it did happen, there's certain steps that you should be ensured to follow. Sorry about that. First thing you want to do is inform your supervisor regarding the incident. Then you're going to complete the incident report online, and you're going to be ensured to document any witnesses or anybody present. You're going to then go to workforce health and safety if it's the injury occurred during regular office hours. And if it's off shift, say for example you're on the night shift, then you would go to the emergency room. And then in the daytime, you would call the union number provided, the office number, and inform them of what happened, and they can direct you what to do next. Here's just a little funny picture I put in here. Of course, I do not expect you to insert any syringes or anything into the electrical outlet in the hospital, but I cannot be there to crack jokes in person, so here's just something to break up the monotony. Weingarten rights, one of my favorite topics, and I always tell the nurses, if you do not remember much from this video, please try to remember when to use your Weingarten rights. Similar to Miranda rights, Weingarten rights means you have the right to have a nurse advocate present during a meeting in which management asks you questions that could lead to discipline. So basically, the nurse advocate is your representation, such as myself or Barbara or the others that you will learn about shortly. So the nurse advocate can assist you in any investigation by management. You can read the following statement to the person you are meeting with before the meeting starts if you are not sure how to request a delegate. It's very simple and it's very respectable. If this discussion could in any way lead to me being disciplined or terminated or affect my personal working conditions, I respectfully request that my union representative, officer, or steward be present at this meeting. Without my union advocate representative present, I respectfully choose not to answer any questions or participate in this discussion. So it's just saying that you have a right to have a delegate present with you when you are being within a meeting. Here's a couple of examples. I'll go over them real quickly. For example, if the meeting is to elicit facts or the employee's side of the story, or to obtain admissions or other evidence, either to determine whether or not discipline is warranted. So, for example, possible wrong medication administration. Hopefully that does not happen, but that would be a time when you would want your union delegate present. Patient complaints. Patient complain you forgot to change your dressing. That's just an example. That would be a time you would want to call your delegate to sit in this meeting with you with the supervisor. Okay, who should you contact if you have a union issue that cannot be solved with your patient care director or manager? Your nurse advocate, once again, is the person to call. Levita Payton, which is myself. I'm in the PACU. Kimberly Dorr, ED. Elsa Siddiqui, ED. And Tamara Echin, ED. Or you can contact the chief steward, which is Barbara Basico. Here is her personal cell phone number, which is 646-678-9334. Her hours are 6:30 a.m. to 10 p.m. And her email is listed here, bou571@aol.com. And the business agent is George Magnuson, and you would contact him at the local office. Wages, Article 19, page 54 to 55. This is the base rate. As of 6/1/2019, we're at $91,980.03, which amounts to 47.16 an hour. And as of June, once June comes, we go up to $94,279.53, which is 48.34 per hour. And that's base. Meaning, by base, we mean that does not include any certification, differentials, your bachelor's degree, your master's, doctorate, clinical ladder differentials. So this is just your base rate. For experience differential, that is $1,000 a year. Up to $1,000 a year. Well, $1,000 a year up to 25 years. For example, if I'm in the hospital for 25 years, I would have an additional $25,000 added on to this base rate right here. Outside experience. So if you worked outside at a hospital, acute care facility for 10 years, you would already be granted that additional $10,000 to this salary right here. Clinical Ladder, as I just mentioned, is a great program. So if you obtain a CN2 here, you would get an additional $3,000. And then if you decide after you get your CN2, you want to get that CN3, you would get an additional $3,000, so which would be a total of $6,000 additional dollars added to your base salary. And here is a little picture of me, Barbara, and Elsa signing the contract. Okay, so now we're going to talk about benefit allocation, which is Article 20, page 57. It tells you how much time, benefit time you get. So if you're on a 7.5-hour shift, I want you to look at, If you're on a 7.5-hour shift, I want you to look at this column. And if you're on an 11-hour shift, you're going to focus on this column. Personal time is 4 days or 30 hours. Holidays, 8 days or 60 hours. Sick leave, 12 days or 90 hours. Vacation is 20 days or 150 hours. After 5 years of service, you get 25 days or a total of 175 hours of vacation time. So that's pretty self-explanatory. Which holidays are we paid for? So the eight holidays that we are paid for can be found Article 7.1, page 24. A couple things about holidays you may want to know is that if you are not able to use your holiday time within 30 days of earning it, you should inform your PCD so that you can get an extension on that time so that it is not lost. And this is just reiterating that holiday time is not cumulative and must be taken. In addition, holiday time is paid at 1.5 your regular compensation rate, with the exception of Christmas and New Year's, in which you earn double time. And for Christmas and New Year's, you are only allowed to work one or the other, not both. Work time differentials. So shift differentials start at 3:30 p.m., which is about $6,000 per shift. And evening shift actually earns about $5,600 for the year. So these are both in terms of for the year. But in terms of our hourly amount, you would actually see the differential as 3.0769, which is included in your base rate. So that would be added to your base rate. Weekend work, we are required 11.5-hour shifts, unless you work in a different unit, is required to work 24 weekends per year. If you call in sick on the weekend, you may be asked to make up that weekend within the next 5 weeks. And that could be found in Article 5.3, page 18. Staff development, that's Article 3.6, pages 7 to 8. Basically, it's a little bit about your conference time. We are entitled to 37.5 conference hours, which is about 5 days, which equivalents to 5 days. It must be pre-approved by your PCD before the new schedule comes out. I mean, this is just to prevent inconsistencies, because in order to provide appropriate staffing, you should get pre-approval from your PCD, and then you pay for your conference, and then you go to your conference. This way it doesn't affect the staffing. So that's the ideal way you should request a conference. The conference can be in the form of face-to-face, webinar, or online module, but it must add up to at least 7.5 CEUs per day. Maximum reimbursement is $600 per year times the number of nurses on the unit. This just talks about full-time hours. So a full-time nurse would work 37.5 hours per week if you were a 7.5-hour shift. 11.5 hours nurse would be working 69 hours one pay period and 80.5 hours the next. Part-time nurses, they would work at least 20 hours minimum to be eligible for our healthcare benefits. Everyone from your start date is on probation for a period of 6 months. Transfers. So perhaps after 1 year on a unit, you decide you wish to transfer to another unit. You will be eligible to do that after 1 year of employment. You can apply, and then you can transfer based on seniority. Educational benefits, a little bit more. Basically, after 6 months of employment, you are eligible for $12,000 per year tuition reimbursement. Another benefit of education is if you have your ANCC certification, you can get a differential of up to $2,300 per year. So if you have a certification, say for example in med-surg or chemo, you receive this additional $2,300 within your salary. If you're not certified, then we encourage you to become certified, and then once you pass your certification exam, once you pass, you can be reimbursed, as long as it is an ANCC approved course and certification. Okay, a little bit about sick leave. Sick leave is earned at approximately 2.307 days per month. After 1 year of employment, the hospital front loads 90 hours of sick leave into your bank. If you were sick and you had to call in, we want to remind you that you must call in 2 hours before the start of your shift, or even more if you know. The sooner the better. This allows your PCD or others to make accommodations for your absence. If you're going to be absent for more than 3 days, you will require a sick note from a doctor, and the doctor's note can then be sent to Workforce Health and Safety. And of course, you're going to inform your PCD. And the phone number for Workforce Health and Safety is right here at 646-697-4727. Political action. Just a couple of brief things about what the political action team does. We build power. We advocate for healthcare of our communities. We promote safe staffing bills, retirement education, and many other things. We promote unity to pass legislation bills that protect worker rights, such as paid leave for COVID-19 illness. And I just like to remind nurses of this statement is that advocacy is a pillar of nursing. Nurses instinctively advocate for their patients in their workplaces and in their communities. But legislative and political advocacy is no less important to advancing the profession and patient care. So, we advocate for many things. So we also want to be politically active to, promote things to ensure that we don't have Medicare and Medicaid losses, things that are crucial to what we do for our patients. Those are just some brief examples. So what are some forms of the functions of the Legislative Political Action Team? Well, our CWA 1104 LPAT activities include assisting with campaigns, lobbying, rallies, organizing, defending against healthcare cutbacks, Medicare, Medicaid, and political mobilization of members. Here's an image of Nicholas Ho. This is our political coordinator. We do healthcare rallies, as you see here. And we do community support. We support different organizations, whatever they may be. Food drives. Here, I just threw this picture in here because it shows a member who was actually on strike helping a lady across the street. I thought that was just amazing that he took time out to do that. So it's just a little heartfelt image there. Some more political action. We speak to assemblymen and senators to promote different legislation. And that kind of summarizes the contract. That I do encourage you to read the whole thing. If you have any questions at this time, you can call Barbara Basico, and her number is 646-678-9334, or email Barbara at bou571@aol.com. I didn't put my email here, but once everyone sends their email in, we have a nurse Google group, so I'll actually enroll you into the nurse Google group, and my email is pretty simple. It's my name, PeytonLevita@gmail.com. So it's been a pleasure doing this video. I hope you enjoy it, and also if you could email me with feedback, that would be awesome. Thanks again, and welcome to New York Presbyterian Law in Manhattan.